Okay. Welcome everyone to Biomonitoring California's virtual meeting of the Scientific Guidance Panel. Today's meeting is being held through GoToWebinar platform and is being recorded and transcribed. All attendees are automatically muted when joining the webinar. There will be several options for providing comment during the meeting, which are currently being displayed on the screen and which our chair, Meg Schwarzman, will also be explaining a bit later. If you'll be speaking during the meeting, please use a headset if possible. Remember to speak directly into the microphone and introduce yourself before speaking. This is for the benefit of the transcriber and everyone else on the webinar. Meeting materials are available to download from our website at www.biomonitoring.ca.gov on the July SGP meeting page. If you have any technical difficulties during the webinar, please send an email to biomonitoring@oeha.ca.gov and we'll have someone from our IT department assist you. We will break at 12:35 for lunch and take a 15-minute break just before 3 p.m. and we will start this meeting promptly at 10 a.m. Okay, and now I'd like to go ahead and introduce Vince Cogliano, who is the Deputy Director for Scientific Programs of the Office of Environmental Health Hazard Assessment, or OEHA. Vince is stepping in today to give the welcome on behalf of Lauren Zeiss, OEHA's Director.
Good morning, everybody. I'd like to welcome the panel and the audience to this meeting of the Scientific Guidance Panel for the California Environmental Contaminant Biomonitoring Program better known as Biomonitoring California. I want to thank you all for participating and for sharing your expertise. The panel last met on March 8th, 2021, and here's a brief summary of the meeting. After the program update, the panel provided input on options for statewide biomonitoring surveillance. The remainder of the meeting focused on the panel's consideration of the class of quaternary ammonium compounds, also known as QACs, as potential priority chemicals. The panel's deliberations were informed by guest presentations on increased exposure to QACs during the COVID-19 pandemic, by environmental detections, biomonitoring analytical methods, and safety evaluations, as well as public comment. The panel voted unanimously to recommend that the class of QACs be added to the list of priority chemicals for Biomonitoring California. In making this recommendation, panel members highlighted the following items: significant data gaps in exposure information and the high potential for exposure in California, detections of QACs in human blood and urine samples, known and suspected human health effects, and the importance of adding the class of QACs to the list of priority chemicals. As production is rising, so we wanted to capture the trends in exposures. Panel members requested that OEHA implement a conflict of interest procedure for guest speakers, and we have done so. So guest speakers are now advised that for purposes of preparing presentations to the scientific guidance panel, a conflict of interest should be disclosed if they or their employer or sponsor have a financial, commercial, legal, or professional relationship with other organizations or with the people working at them that could influence their research. They're asked to include a slide at the beginning of their talk, either to state that they have no conflict of interest to disclose or to describe any conflict of interest that they have. A summary of input from the March meeting, along with the complete transcript, is posted on the March panel meeting page at biomonitoring.ca.gov. Because we're meeting virtually today, I would like to have panel members introduce themselves. I will call on each member and ask you to unmute yourself and state your name and affiliation. So I'll begin in alphabetical order with Carl Krainer.
Oh, Carl, I think you're muted.
Okay, we'll come back. Carl, you're still on mute, but we'll come back to you. Oliver Fien.
My name is Oliver Fien. I'm professor at the UC Davis Genome Center. I'm an analytical chemist and like to look at both low abundant molecules as well as complex mixtures of molecules.
And thank you. Ulrika Luderer.
Hi, my name is Ulrika Luderer, and I'm the director of the Center for Occupational and Environmental Health at UC Irvine, and my research area is in reproductive toxicology.
Thank you. Tom McCone.
Hi, I'm Tom McCone. I'm a professor emeritus at the University of California, Berkeley School of Public Health, and I'm also an affiliate at the Lawrence Berkeley National Laboratory. These are both institutions that I spent more than 25 years working at, but now I'm in retirement, but still active in some areas.
Thank you. Jenny Quintana.
Hi, my name is Penelope, or Jenny Quintana. I'm a professor in the School of Public Health at San Diego State University in the area of environmental health. And my area is environmental justice in communities at the US-Mexico border and exposures to children.
And thank you. Veena Singla.
Good morning, I'm Veena Singla. I'm a senior scientist with the Natural Resources Defense Council in the Healthy People and Thriving Communities program. And I work on healthier indoor environments and bringing the most current scientific principles and data to inform policy.
Okay, thank you. Let me come back to Carl Krainer. I see you're still muted, it looks like.
Yes, Carl, I need to click the red. I sent an unmute request. If you could click the red microphone button.
Or I had the same thing happen to me, Carl. The button disappeared, but at the very top of the line, you can go to audio at the very top of your screen on the menu option. And then under audio, you can do unmute.
Well, it looks like there is a difficulty there. Anyway, that's Carl Craner from the University of California, Riverside.
Yeah, and Vince, this is Sarah Hoover. I'm just going to chime in to tell Carl. Carl, if you have, we'll try to troubleshoot on a break. And if you have questions in the meantime, you can put them in the chat or email them to the Biomonitoring California email address, and we'll read them aloud.
Okay, thank you very much. And now I'd like to turn the meeting over to Meg Schwarzman, who's our panel chair. Meg, it's up to you.
Thanks. I think I am unmuted. You can hear me okay?
Yes, we can.
Great. I am Meg Schwarzman. I'm at the UC Berkeley School of Public Health in the area of environmental health sciences. And I, as chair of the panel in today's meeting, want to start by announcing the goals for today's meeting. The first item of the day, as usual, will receive a program update, and a little less as usual, provide input on the recommendations for Biomonitoring California's 7th report to the legislature. We'll next hear a detailed update on the targeted biomonitoring study in an AB 617 community, and we'll provide comments on their current plan, And the remainder of the meeting will focus on the use of biomarkers of effect in air pollution studies, including intervention studies that use air filtration. We'll start with presentations by guest speakers from University of California, Simon Fraser University, and Colorado State University. And after those presentations, we will have, excuse me, an open discussion with the guest speakers and the audience. And that will focus on topics including study design issues in air pollution biomonitoring studies, timing of urine sample collection, given whichever biomarkers are being measured, which factors should be included in questionnaires to participants, and interpreting results for biomarkers of oxidative stress and inflammation as indicators of exposure. So we'll be having an open discussion about that and hopefully providing some input. There will be time for questions from the panel and the audience, as usual, after each presentation. And during the question periods after each talk, speakers should remain unmuted with their webcam showing so that they can respond to questions from the panel and from the audience. For panel members, if you want to speak or ask a question, please just physically raise your hand, not in the interface in the GoToMeeting, and I will call on you at the appropriate time. You can then unmute yourself to ask your question or provide your comment. Attendees of the webinar, if you have questions or comment during the question periods after each talk, you can submit them, as Stephanie said earlier, via the question feature of GoToWebinar or by email to biomonitoring@oehha.ca.gov. Please keep your comments brief and focused on the items under discussion, and we'll read aloud relevant comments. We'll paraphrase them if necessary. During the public comment periods in both the morning and the afternoon, and during the afternoon discussion session, we also welcome oral comments live from webinar attendees. And if you want to speak, please use the raise hand or question feature in the GoToWebinar platform, and we'll call on you at the appropriate time. So I want to start by introducing, for our first agenda item, Nerissa Wu. Nerissa Wu is Acting Chief of the Environmental Health Investigations Branch at the California Department of Public Health, and she's overall lead for Biomonitoring California. She'll provide an update on current program activities and request panel input on recommendations for the 7th report to the legislature.
All right, good morning. Let me show my screen here. Do you see my slides? Okay.
Yes, but not in presenter mode.
Yeah, and I'm having trouble kind of getting into minimizing my GoToMeeting so that I can change them into presenter mode. Here we go.
There we go.
Okay. All right. And I just want to make one correction. I'm no longer the acting branch chief at EHIB. We do have a permanent branch chief at this point, but I am still a program lead. Good morning, everybody. I have 15 minutes to update you on a number of activities, so I am going to crank through these fairly fast. I want to start off by talking about the budget, and this is a slide that's familiar to many of you, depicting the program's budget over the past 5 years. But I have the great pleasure of bringing some good news to this panel. We have a new state budget that has just recently been signed that includes an additional $2 million appropriation for the program. So given our, I know, yay, given our baseline funding of about 2.2 million, this represents a really significant increase to the program. So 14 years after the formation of the program, this is our first permanent state budget increase. It's very recent news, so it's pretty premature to be talking about how this money will be spent within the program, but in general, the funding is intended to support surveillance, to track temporal trends, and to help us interpret the results of community-focused exposure studies. The funds will be used to hire more staff, laboratory analysts, epidemiologists, health program specialists, basically all the people that are needed for the different aspects of biomonitoring. And there's also, for the first time in our program's history, state funding to support the operations of the program, purchase of supplies, and so on. So really grateful for this. Big thank you to our supporters who have worked so hard over the years to raise awareness of the importance of biomonitoring. We do have some staff changes to announce. We have a new research scientist 3 in our EPI group, Dina Dubraka, who was actually with the program 2010 to 2012, so she's not entirely new. Welcome back, Dina. We're very excited to have you in the program. We also have a couple of departures shown here in red. Julia Varshavsky, who has been with OEHA for the past year, has taken a position at Northeastern University, where she'll be an awesome addition to their faculty. And Jennifer Mann retired in May, both super talented epidemiologists who made enormous contributions to the program. So we very much appreciate their work and we miss them. CDPH staff continue to be redirected for COVID work, although to a lesser extent than before. But between staff changes and redirections, and we're all still mostly teleworking, it has not been an easy time for us to work as a team and to maintain a sense of continuity. So kudos to everyone who has worked really hard to remain productive and to take on all these extra burdens. One example of a task that's made much harder by teleworking is results return. When we create the results return packets, it's really an all hands on deck kind of situation, which was made a lot harder by not being able to assemble and physically work on the packets together. But results for Care 3, our 90 participants have been sent out. These bound packets have been a standard of the program for many years. So those of us who are not in the weeds of producing those packets might not know what goes into them. So I just want to acknowledge the hard work that goes into producing these packets. It's many hours of writing up fact sheets, data management and analysis, formatting, making sure all the data ends up in the right place for the right person, and then gets bound up in this nice packet. And we did get some positive feedback from our Care 3 participants, with a couple people noting how impressed they were with the information provided. It's also really great to get feedback and suggestions from participants to help us understand how we can be useful to our participants. So for example, one participant noted that would be helpful to get a summary of results so they could give it easily to their medical provider. This kind of feedback is great because we're always trying to tweak and improve our results material, and our goal is always to be as useful as we can be to our participants. So now that results are out to participants, we can turn to conducting our demographic analyses and getting summarized data posted. And there are many different ways we try to distribute our findings, both to individual participants, but also to a broader public. And this wasn't, I'm going to go back a couple slides. I did not have an X here to indicate that we have another product coming out because it's just been finalized this week. but we've just finalized a 4-page newsletter style publication on the CARE LA results that we'll be able to post and otherwise disseminate. So that will be coming out in the next couple weeks. And this is a format we hope to use to broaden our distribution of study findings. So as we've discussed in the last couple meetings, we are continuing to explore options for surveillance to determine the best study design to implement in the coming years. As part of that, we're putting significant effort into looking back, documenting and evaluating CARE, and we're doing a similar effort with BEST, taking a look at the methodology and the data that was collected. I think it's really important to look back in order to move forward. It helps us identify lessons learned and to weigh some of the different design choices that we've made in the past. One of the issues we've been discussing is weighting both for BEST and CARE data. We want to compare our data between regions, between California and Haines, and actually external researchers use our data as a basis for comparison for their own studies. The data that we have posted and that we've presented here and other forums has been unweighted, which is fine as a reflection of study statistics, but if we're going to use this data as population tendencies, we need to be able to weight the data so that it reflects the underlying population. For a number of our analytes, such as PFAS, there are associations with sex or age or race, and so using data that's unweighted for those parameters to calculate central tendencies can give us a skewed geometric mean, for example. So we're putting some effort now into weighting the previously collected data, and it's also helping us think about when we go to design a future study, how do we generate the most useful data possible. We're also in the process of producing a report on the CARE study, which is something that we haven't done for projects in the past. It's a significant task, given the scope and complexity of CARE, but it's another opportunity for us to really evaluate how we did and also share the methodologies and findings with a wider audience. So the report will include information on field and lab methods and study results, summaries per region, participant demographics, as well as comparisons between regions. And this is data that has been presented in this forum to an extent, but this will be a more detailed version of that. We're also continuing to look ahead to explore potential collaborations. For example, we've met with the Childhood Lead Poisoning Prevention Branch within CDPH to talk about how we might work together to conduct surveillance of pregnant women, to identify women with elevated lead and mercury levels so that we can target intervention and reduce exposures among pregnant women and newborns. This is similar to what Minnesota and New Jersey programs have done. And we're continuing to talk to colleagues from other states. New Jersey has come up with a temporal comparison for their PFAS data using weighted data. New Hampshire and Massachusetts are coming out with reports on their first round of surveillance. And we have the current CDC grantees, New Jersey, New Hampshire, Minnesota, Michigan, and Iowa starting up their fieldwork. So we're following their progress, watching their study designs to help inform our path forward. So we're going to continue this exploration of different surveillance methods over the next year. With our recent budget news, we're more hopeful that we'll be able to implement some of the ideas we've discussed, and we'll continue to report back to you to get feedback. So I just want to turn to laboratory activities. We haven't been in the field this last year, but the labs have been very busy with collaborations. EHLB has been working on the Precado study to measure tobacco and cannabis exposure among pregnant women. They're also working with the Women Workers Biomonitoring Collaborative to look at PAH levels in firefighters at multiple time points following participation in a fire response. ACL has been working on the discovery of novel environmental chemicals in maternal infant pairs, doing non-targeted screening on 300 paired maternal and cord blood samples. They are also involved with the Women Worker Biomonitoring Collaborative using non-targeted screening to compare chemical exposures between firefighters, office workers, and nurses. The PFAS and maternal cardiovascular disease risk, looking at PFAS levels in 250 study participants. The Earth Center measuring POPs and flame retardants and non-targeted screening, and the N of that is still to be determined. And finally, there's the environmental influences on child health outcomes, or ECHO pediatric cohorts, for which they're looking at PFASs in mothers, both in California and Illinois, with a total N of about 1,000. Both labs are also actively working on developing or improving methods, mercury speciation, a method to measure stable VOC metabolites in urine, expanding or automating the expanded PFAS panel, as well as developing a new GC-QTOF non-targeted method to screen for volatile and semi-volatile chemicals. And finally, I want to talk about the legislative reports. Just a reminder that our founding legislation calls for the submittal of legislative reports every 2 years. So Report 7, which covers July 2019 to June 2021, is due at the end of this calendar year. So we're working on that now. As you might remember from our last LED report, LED 6, we include program recommendations from this panel. And for LED 6, there was a discussion at the July 2019 meeting about what this would include. And you can see the recommendations as they ended up in LED report 6. So things like maintain core laboratory capabilities and develop innovative and efficient laboratory methods, improve the care study, conduct biomonitoring studies that seek to better understand and mitigate environmental health inequities, expand assistance to local agencies, expand and improve health education, conduct biomonitoring studies that seek to better understand and mitigate environmental health inequities, and whoops, did I already say that one? And conduct biomonitoring studies to evaluate the effectiveness of regulatory programs. Sorry, I went a little out of order. So we'd like to have a similar list of panel recommendations to include with LEG 7. And over the past couple of years, we've had a lot of discussion about the directions of the program, what to prioritize and where to focus our surveillance efforts. So in these next couple of slides are things that we have captured from those meetings. Some of them are similar to LEG 6. They're recommendations that are kind of eternal for the program, I guess. But this list is not exhaustive, and it's certainly not a closed list. You can continue to add or delete from this list or elucidate on an idea that's on here. I will say that it's most helpful to us if the recommendations are specific. All the ideas are important, but it's helpful if not everything is a priority. And I guess the other thing I'd say is if it's helpful if the recommendations are feasible given our program limits, because even with our new expanded budget, we clearly can't do everything. So it's good to be aspirational, but it's helpful for us to get a sense of where recommendations are within a feasibility. So some of the recommendations are about general program directions, things like conducting studies that seek to better understand and mitigate environmental health inequities, design studies to focus on differences across demographics and types of communities, like rural versus urban, conduct intervention studies to link community needs with biomonitoring, prioritize studies of exposures among children, study impact of wildfires, not only among firefighters, but also cleanup crews and field workers, promote fee-for-service, laboratory capabilities to help us support the program, maintain core lab capabilities, develop innovative and efficient lab methods, and ensure that study results are distributed to the broader public. Some of the feedback we've heard has been more specifically related to surveillance from our last couple of meetings, and we've heard the following, that we should consider less expensive ways to collect samples, things like in-home self-collected samples or using banked samples, or perhaps even turning to using wastewater treatment samples as an indicator of exposure as compared with our current urine and blood collection. We've heard that we should collaborate with others on participant recruitment, interpretation of non-targeted screening data, and data analysis, helping bring in some expertise, perhaps from doctoral students. Ensure that surveillance studies reflect the population with respect to education and income level. We should recognize that studies can't address all questions, and so we should prioritize temporal trends over geographic trends. Conduct studies that can help evaluate the effectiveness of regulatory programs, publicize policy relevant studies, and we should focus on what makes California different so we're not replicating work that exists in other forums. So those are some of the recommendations that we've heard over the past couple of years. And again, this is not a final list, but we would like to be able to include formal panel recommendations in our next LED report. So perhaps in the discussion, we can talk both about what should be retained in this list, if there are things to add or delete, but also discuss a process by which this list is finalized and provided to us. So I want to stop there I want to thank the panel for your attention and support. Thank our stakeholders again for the amazing work you've done over the years for the program. And of course, thank the staff of Biomonitoring, without whom none of this would be possible.
Thank you so much for that, Nerissa. And it's so great to have the good news. Congratulations to you and to the staff and to everyone who has advocated for that change over the years. I think it's a pretty wide community. I want to open it up to questions from the panel for Nerissa, and we'll have a panel discussion about those the legislative report priorities in a minute. So this is just a moment for questions to Nerissa. Yeah, Jenny.
Hi, I was happy to hear the good news. But the question I have is, over the years, we've talked about that this program has not been funded to do the initial intent of the program, which was to provide a population-weighted snapshot of all of California, similar to the NHANES CDC environmental health study. And so I guess my question is, how much does doubling your budget bring you to being able to do it, quote unquote, right, to do the study that was envisioned when this program started? Like, I think it's still short, is my gut feeling.
Yeah, that's a really good question. And I don't want to stand up here and say, give us more money, but the initial assessment of what this program was initially envisioned to do was $10 to $12 million, and that was in 2006, 2007. And when we've done sort of updated assessments of what it would take using the CARE template to do sort of a 2 or 3 year cycle around the state, it was similarly $12 to $14 million. So clearly a $4 million budget is not going to accomplish that. I think we need to continue down the path of finding alternatives to that full state probabilistic model, but I think there's a lot more we can do. I think we have some really good potential study designs that will help us have the most public health impact we can. Perhaps not the all-encompassing surveillance we'd like to do, but it will help us accomplish those goals. And it's still, it's still a doubling of our budget.
Tom.
Thank you for the presentation, very informative. I'd like to add another question on a similar line, but more about the stability of the 2 million. You indicated that it would be lasting, but I guess the question, a lot of different organizations, agencies in the state got additional money this year because there was a big surplus, and they really wanted to get the surplus out. But we don't, is there any sense of how stable that might be, or when we'll get to a point where all of that added money is going to be pulled back?
The allocation is described as its general fund, and it's described as ongoing annual funding, which is awesome news. Budgets change though, so it's nothing is guaranteed, but it is currently in our budget as ongoing.
Thank you.
We have 10 minutes for public comment now before we go on to the discussion and provide the program with some input about the ledge report. So I want to check with Shobha if there's any comments from the public, and Stephanie, I guess, on the webinar or the email.
This is Shobha. I'm checking and I'm not seeing any hands raised or comments in the chat or questions.
I'm actually just going to give it a minute since I just announced that and we're a little bit ahead of schedule. So why don't we just give it a minute if there's somebody who wants to participate at this moment in the discussion of the program update and the legislative report. And then we'll turn to that discussion.
That is a great idea because we did just get a question coming in. So I'll read it aloud. This is from Ahimsa Porter Sumchai. And I think it's a comment saying, I would like to encourage Biomonitoring California to include in its recommendations the use of geospatial mapping in survey work to identify patterns and distribution of exposure, and to promote the use of advanced environmental justice and screening tools, including the EPA EJ screen that allows mapping of 11 environmental indicators, including PM 2.5, lead-based paint proximity, traffic volume and proximity, hazardous waste, and Superfund proximity and diesel particulates. So that was one comment. We have another comment from Nancy Biermeyer about groups that supported the budget augmentation. So I can go ahead and read the list that she's provided here, which is quite extensive. Shall I read it aloud?
Hi, Shobha, this is Sarah. No, I don't think that's necessary. We can just have it as part of our record and just note that we have that information.
Great. And thank you for the information, Nancy. And those are the only written questions I'm seeing come in.
Great, thank you so much, Shobha. And we will continue to have opportunities for public comment after each presentation. So just keep that in mind if you're listening, and you can tee up your questions, and we'll try to, since it follows the panel question session, folks can just kind of know that if they, while the panel is asking clarifying questions, they could submit questions or indicate on GoToWebinar that they have a question, and we'll make sure to get it into that moment in the agenda. So thanks, Shobha, for doing that on the fly. Let's see, Sarah, I guess, so we're going to start the panel discussion now about the recommendations for the legislative report. But I had a question to start us off that's kind of for Sarah Hoover, which is responding to the public comment that we just received about encouraging the use of geospatial mapping, and specifically the EPA EJ screen. And I'm wondering if you could say anything about the program's use of that versus the CalEnviroscreen indicators that's specific to California. Do you have anything to? Okay.
No, I don't have anything to say, but we'll, this will be in the transcript, and it's something we can follow up on. I will also invite Nerissa. I don't know if you wanted to say anything about that particular comment, but I think we'll just. Sorry?
Yeah, no, I do not have a comment.
Yeah, okay, yeah. And also, Meg, feel free, in addition to discussing the ledger report recommendations, you can feel free to provide input on other elements of Nerissa's update.
Okay, great. And by that, I assume you mean basically sort of program priorities and next steps on the various projects that Nerissa updated us on.
Yeah.
Okay. I guess just to close out that topic that I just raised, and then I want to open it up to the panel for discussion of the program priorities and discussion of the recommendations for the legislative report, I hear that comment as being very much in line with the priorities that we've expressed to the program for at the timing for Ledge Report 6, and also in the comments that Nerissa highlighted about things that have sort of come up over the last couple of years that could feed into Ledge Report 7 if we want to, about making sure that we are looking at uneven distributions of exposures among populations, and specifically with an eye toward environmental injustices and inequities. And so I think I support those comments, and then just have that open question about how the program has used the EPA EJ screen and whether it feels like a useful addition, since in California we do have the much more California-specific CalEnviroscreen that lets us draw on those metrics of California communities. I think that's all I wanted to say about that. Tom.
Yeah, just so we do have a special tool that's quite impressive in CalEnviroscreen. But in terms of the comment about making better use of satellite data and other kinds of surveillance, it might be, I don't know whose realm this fits into. It might really be more of a broader agenda to consider integration of CalEnviroscreen results or some sort of augmentation of those results with all of the emerging GIS, all of the mapping data, all of the things that people are doing for that also. And I don't know, I mean, it could be a small effort, but there is a lot of new information coming out from these mapping tools. And I think rather than say CalEnviroscreen does everything we need at this point, it might be useful to say, well, let's just check into this and see if it could be enhanced with some of that information. But again, I don't know if that's necessarily a recommendation that's biomonitoring specific. I think that's more specific to the whole agenda of trying to understand the distribution, inequities, time history, the interaction of social and environmental factors. And that's a much broader agenda than biomonitoring. So we might say something on that, but I actually think it's something that's a little bit out of our realm of recommendation.
So Tom and Meg, I will chime in to say a little bit about this now. We actually are doing that sort of work in terms of for analyzing the East Bay Diesel Exposure Project results. We'll also be doing that type of work in our AB 617 biomonitoring study. And obviously CalEnviroscreen has played a big part both in identifying locations for the diesel project and also for AB 617 communities. So it's definitely integrated. In fact, sort of that whole concept of environmental justice is a founding principle in the enabling legislation. We take your point though, Tom and Meg, about just focusing and tracking new tools for GIS mapping and taking those into account. That's definitely something that our analysts are aware of.
Thank you. That's good to hear.
Thanks, Sarah. Other comments from the panel? This is kind of an open discussion opportunity. Jenny.
I just want to briefly add to the past point that I think that it would be enough to say that we would try to add GIS layers as they become available that inform our biomonitoring plans, but also to use them to make sure we are addressing disadvantaged communities and populations. So maybe in using them in two ways, I think we can make a positive statement, because CalEnviroscreen does lag a little bit behind data that's available because they have to make a decision about which to apply to which variable. So I think it is good to make a statement that we want to incorporate them and also use them to evaluate our programs. But is this the open discussion part? I can say something else too. Okay, to make sure. Just looking at the list of priorities, a couple that came to mind is that breast cancer concerns were very foundational to passing this legislation in the beginning, and activists in that area. And I just feel like we haven't, as a program, really specifically said we'd like to address that. And it'd be interesting, especially given the new capabilities and focus on non-targeted analysis, which could have the potential to discover important chemicals, especially thinking of things that might inform breast cancer, biomonitoring, perhaps by using nested data from ongoing studies, because of course, cancer takes a long time to develop. But I just think that I'd like to see that in our priorities somewhere. I think that given a lot of chemicals that are endocrine disruptors and maybe ones we don't know about, I think that would be something that our program should look at. And then the second area I haven't seen in this list, unlike pretty much every other list I've seen for other efforts I'm involved in, is explicitly mentioning climate change. And certainly that's implied in the wildfires bullet point. As we all know that wildfires are increasing in severity and number, but I think I would like to see that maybe explicitly said, that look at exposures that may increase with climate change, for, as example, wildfires. Thank you.
Jenny, are there any other exposures that you have in mind associated with climate change?
I was just thinking that, and I was not actually sure. I was just thinking, what chemicals with increased heat might be more, like volatile chemicals, might be higher concentrations, for example, from air pollution emitted directly from vehicles. And I don't have an answer to that, but I was actually thinking of that exact question as Nerissa was speaking. So, but I think maybe thinking about that explicitly in the future would be good.
And it sounds like even explicitly making the connection between the interest in wildfires and climate change.
Yes,
even adding a recommendation for other things to analyze. Tom, I see your hand. I just wanted to add on one thing to what Jenny said, and then I'll have you speak, which is on the breast cancer related chemicals. I can share with the program very soon a draft that I'm currently reviewing that's from my research group. That's a new, in concert with Silent Spring, that's sort of an updated mammary gland carcinogen paper that includes a lot more hormonally active compounds. And so just to sort of offer that as a resource in the coming months. It's not ready today, but thank you for that.
Thank you.
Tom.
Yeah, I just wanted to follow up to that. There are studies that have indicated that climate change can augment, enhance exposures to existing pollutants by changing, climate conditions, hotter, drier, more or less wind. So I do think that, I actually did a paper on this 20 years ago about how a changing climate would affect the transport and distribution of volatile and then persistent chemicals. So there is some, and there's been more work since then, but there is work going on. So I do like the idea of making it climate related, because climate basically alters a lot of the conditions of vulnerability of populations and the level of exposure. Also, just to follow up on the issue of wildfires, and I think John Balmes may bring this up, or I've talked with him about it. The wildfire particulate matter and wildfire emissions are different from PM associated with roadways and other sources. So it is a different kind of exposure. So it is, and again, it's something we've always had, but the distribution is much wider, more intense. So it is a climate-related issue, and it really deserves collecting more data, because it's a new, in a way, a kind of new kind of exposure to something that was historical but is now made different by the conditions of fires and a changing climate. So again, I do second that recommendation to kind of tie this into climate as a key part.
Thanks for that, Tom. One thing I want to add too is that, of course, when we're looking at exposures due to wildfires, it's not just PM that's different, right? It's also because of the fires at the urban interface, essentially, it's exposure potentially to lots and lots of other compounds associated with what we're calling wildfires, but that actually involve a lot of built environment and their components. Vina, you had a comment.
Thank you. Yes, I third the suggestion to draw the explicit connection to climate change. And, you know, this is, I'd say, not necessarily a recommendation or a priority for the program, but just to note that another area of connection to climate change, something that I'm focused a lot on these days, is thinking about building decarbonization, which encompasses electrifying buildings, removing fossil fuel combustion from buildings, as well as building energy efficiency improvements, and the effect of those on indoor environmental quality. So I'd say that's another really important area of connection between actions the state is taking on climate change and potential exposures to people in the indoor environment. And the other comment I had is I wanted to express continued strong support on the first bullet on this slide, the studies to better understand and mitigate environmental health inequities. I think, as Nerissa said, that's a ongoing important priority. And I think a couple other pieces on these slides are connected to that. And in terms of the mitigation piece, mitigating environmental health inequities, I think the intervention studies linking community needs is something that can really help inform the mitigation question for kind of individual and community level actions. And then I believe on the next slide there was a bullet about policy relevant studies in science, and the sort of assessing the effectiveness of policy interventions. And I think both of those are also connected to this question of mitigating environmental health inequities. So I think, again, the environmental health inequities piece remains a priority, and that there's other types of science and studies that can help inform the question of how to mitigate some of those inequities.
And when you say that other sorts of studies, Vina, you're circling back to what you said about intervention studies that sort of meet the needs of a community at the same time as we're gathering data, and also ones that assess the impact of policy.
Yes, you got it.
Thank you. Just want to make sure I understand. One of the places that I'm going with this, just to foreshadow a request that we have to, I will make of you, is that we as a panel need to summarize these recommendations in a letter to the program. And so I will be asking for a volunteer to help write that letter, but that's why I'm clarifying ideas and making sure I get it right. So what other comments do panelists have about these recommendations that you see on the slides, or other recommendations that you either want to highlight or make sure get in for the next round? Is there anything on this list that you either want to disavow or, like Vina did, kind of reiterate and expand on? Jenny, you had something?
Hi, I just wanted, if you could toggle through again. I feel like that non-target analysis is not specific. Oh, here it is. There is an item that's kind of vague, that the second bullet point that we're looking at right now. I think that's the only bullet point that mentions non-targeted analysis. Is that correct?
I think that's correct. And these are sort of harvested from discussions we've had in the past, so they weren't specifically phrased as program recommendations. So certainly can elucidate on the point now.
Well, I think we should talk about why we want to use non-target analysis. And the reason I'm bringing that up is because we're just writing a paper on non-target analysis and house dust. And some of what we get is drugs of abuse, for example, in the dust, which may have been left by our current participants or maybe past participants. But I think when you have non-target analysis, you have such a wide net that I'd like to kind of explicitly say that what we're looking for is industrial or commercial chemicals that we didn't know, were in the environment. And there's certainly many examples of those. I'm not sure if you're familiar with that story about the tire component that was turned out to be killing all the salmon that was found by non-target analysis. I mean, that's a home run for non-target analysis. So I think I just like to really kind of make it explicit that we're looking to see what chemicals, but we're not. And that it also brings up an issue of how we handle data like that in terms of results returned to participants. So I guess what I'm saying is I think of using that as kind of a pooling samples to look at results rather than individual results for the IRB, the human subjects reasons, and to make it more explicit. I think it's an issue when you use non-target analysis. And I know there's experts on the panel, more expert than I, but just I was thinking maybe of having a bullet point a little more targeted towards that. No pun intended. Thank you.
Okay, so that's helpful. That's suggesting that we call out as a separate point the value that we see in non-targeted analysis, not just like this as a subset of, this was obviously a comment that we were making in response to how to help with participant recruitment, or how to help the staff get done all the work that needs to get done. And one of that was like this heavy burden of interpreting non-targeted screening data, but it's not actually saying we really recommend, or we see the value of and recommend the use of non-targeted screening. Okay, Carl. Carl, we can't so far hear you.
You are unmuted, but perhaps your microphone isn't working now.
What sometimes helps if you take off the earphones and just directly use the microphone of the computer and deplug your microphone.
Sorry, Carl, if you want to email your comments. You can troubleshoot during lunch.
Okay, so we'll await an emailed comment from Carl. We have Ulrika and Vina, and I think we also have one emailed comment about a legislative report recommendation.
And Meg, I will say real quick, sorry, Ulrika, for Carl. Carl, if you want to try, I have had this experience with GoToWebinar that audio starts working again if you leave the meeting and rejoin. That'll mean you're briefly out of the meeting, but if you want to try that so that you can actually speak before lunch, you could give that a shot, and we'll just know that you'll be back.
He did restart, Sarah. This is Stephanie. Just seems there's another issue.
Oh,
happening.
well. Okay. Thanks, Stephanie. Back to troubleshooting during lunch. Apologies. Please continue.
Over to you, Ulrika.
Okay, thank you. I just wanted to say that there are quite a few different items on these lists here of things that that we would like the program to do, and I just think maybe we should focus on maybe separating them into things that we believe are the top priorities and that are doable within the the current budget versus things that we would love to see happen, like a you know, like what the program was originally legislatively mandated to do, which is a population-based sample of the whole state, which we know is not feasible currently, sort of not forgetting that that was the original idea, but then focusing on, well, what can be done, you know, which of these recommendations can be done within the budget. And so, you know, a lot of the, let's see, you know, for example, you know, the one that the slide that is currently up, you know, considering less expensive ways to collect samples obviously addresses that, but also some of the other suggestion types of studies. So, you know, studies that focus on a particular community, that also addresses the need to understand and mitigate environmental health equities. So, you know, focusing on environmental justice communities. I mean, I think there's several bullets that relate to that. You know, studying the impact of wildfires is another one. So more focused studies, but then also say that, you know, that ideally in the future, it would be great if the funding were available to also do, you know, a more NHINS-like, you know, ongoing study that's a population-based biomonitoring study that can assess temporal trends across the whole state over time.
Thank you, Ulrika. Vina, you had another comment?
Ulrika said exactly what I was going to say, so that's it.
Great, thank you. And Shobha, would you read the comment that was submitted, please?
Sure thing. So this is a comment that Nancy Biermeyer sent over the questions feature. She has a legislative report recommendation, and that's to include a clear section that could be used as a pullout explaining what the budget augmentation has been used for and allowed the program to do that would not have been possible without the additional funding. This would be very useful to advocates to continue to build and expand support for the program.
Great, thank you. So that sounds like a recommendation to the program in preparing the legislative update, and we can echo that, but it's not something that the panel will do. Thank you for that comment. Anything else? We have about 2 more minutes if anyone else wants to make a comment. And Jenny, if you have a quick thing, great.
I was just wondering if you could toggle through again through the list. I just wanted to think maybe over the break we could number them to help order them. If the panel is actually going to follow up on Ulrika's suggestion to perhaps prioritize them. And I also wanted to see if we had, I don't think we have a specific bullet point that says we want to explicitly link to promoting policy. Like we have publicized policy studies, but I feel like the power of biomonitoring is very strong in terms of intervention studies. You show that people got an air cleaner and their body burden dropped, or they changed their cosmetics, and it's a very powerful tool for advocating certain changes. And I'm just wondering if we should more explicitly say that. I think we talk about intervention studies, but it's kind of very modest language, I guess. So I'm just wondering if that is a priority for the program and we should maybe call it out. Thank you. Hope that wasn't too long.
Hi, Jenny and Meg. Sorry, I know we have 1 minute. Meg, I think if you go back to the Leg 6 recommendations, there was a recommendation about linking to conducting to evaluate the effectiveness of regulatory programs. I think that might be sort of along the lines you're talking about, Jenny. Is that, or you can think about a rephrase if you'd like to get more of your concept.
Well, I think that would be great for, say, carbs clean diesel projects, that bullet point, but even things that are not linked to regulatory Yeah, so that
Like
just
like
maybe
shifting market, market
yeah,
shift.
like a green,
Yeah.
using greener cleaners or something like
Yeah,
that,
yeah,
which would not. Yeah, that's what I meant, I guess, as well.
yeah, that makes total sense. So what I'm going to just chime in and say that Jenny's comment about, oh, is the panel going to work on this during the break? Not exactly. However, what we could consider, since we're almost out of time, Meg needs a volunteer to help her work on the letter. We also could consider, if we have time at the end with the open public comment period, to let you guys look at this more, and then we could come back to that just so you can say, okay, here are our favorite top 10 priorities. If you want to do that, because we need to do that in the public meeting. We can't do that offline.
I actually I recommended that you guys put numbers on these during the break so we could vote for our numbers. That's what I was saying, just to be clear.
Well, but I'm talking about the vote.
These are not vote, but these are not numbered, so we can't say I really like number 6 and number 9. It's hard for us to.
Yeah, these were not intended to be. These are just summarizing what you guys have told us before. They're not intended to be the official recommendations that we're saying we would include. They're just food for thought, which I emailed. We emailed to you ahead of time a lot of your past input. Anyway, I'm going to pass it back to Meg, and Meg, you can decide how you want to proceed.
I was also going to suggest, this is Nerissa, that we can create a slide that has these more clustered onto fewer slides so that you have something that's a little more easily viewed for the next discussion.
Yes, and as I understand Jenny's comment, which I would support, the request for numbering isn't to order them or prioritize them. It's simply to give us a way to communicate over this thing to point to. Instead of saying the middle bullet, we can say idea number 7. So
yes, I understood that. I'm just trying to figure out the mechanisms of how you're going to communicate that information to us, because we're moving on to our next item now. So that's my point. It needs to be in the meeting. So why don't we say, yes, we will, like Nerissa said, she'll create a consolidated slide with all of these numbered. Maybe what we can do is in the lunch period, we'll put it up on screen along with the other advice about we're on lunch, and then you guys can view it. We can also email it to you, but we need to provide it to the public as well. And then we can circle back in the open public comment period if there's time to have last comments from the panel. Does that sound like a reasonable plan?
That sounds fine.
Okay.
I need a volunteer, and it's just one because of Bagley Keene, to work with me doing this summary once we feel like we have an indication from the panel. Is there somebody who would work with me on doing that basic summary to the program? And we don't get to go on to our next agenda item until I have a volunteer. Jenny, thank you very much. Okay, so we will take what we can from today, from later discussion, and Jenny and I will work with it, and then we will pass. I assume we'll work with staff on how to pass it back by the panel for sort of approval. So thank you all for that discussion, and I want to go on. We're going to go on and have our update on a biomonitoring study in an AB 617 community. So I want to introduce Susan Hurley. Susan's a research scientist in the Safer Alternatives Assessment and Biomonitoring section of the Office of Environmental Health Hazard Assessment. Susan will be providing an update on the targeted biomonitoring study that's being planned in an AB 617 community. I'll let her describe the rest.
Okay, thank you, Meg. Let me just get my slides up here. Can you all see that?
Yeah.
No.
Yes.
Yes? Okay. All right, now I just got to get rid of this. Just give me a second, sorry. Okay. So good morning, everyone. Before I start talking about the plans for our study, I just wanted to start my presentation with a little bit of background about how this study fits in with AB 617 activities. And then I'll give a brief update on what we've been up to since the last time we presented on this project, which was back in November, last November. Then I'll go through some of the specific plans we've got for our targeted biomonitoring study and finish up with some challenges that we're still grappling with and hope to get some input from all of you on today. So AB 617 was passed in 2017. Its overarching goal is to reduce exposures in communities that are disproportionately impacted by air pollution. So it requires engagement with communities to develop and implement air monitoring plans as well as exposure reduction strategies. And to help implement AB 617, the California Air Resources Board, or CARB, established the Community Air Protection Program. Now, OEHA is providing support to CARB, as well as the air districts and communities in a number of ways, including evaluating and interpreting potential health effects from air exposures, as well as evaluating health benefits from reducing those exposures. We're also identifying and tracking community air pollution concerns. And then we are designing and implementing targeted biomonitoring studies in AB 617 communities. And so the goals of these biomonitoring studies are first to increase our understanding of air pollution exposures that are faced by people living in these communities, and also to evaluate specific emission and exposure reduction measures that these communities are pursuing. So we're currently planning our first AB 617 biomonitoring study, and that will be the topic of the rest of my talk today. We've been busy from the very early stages of our planning process. We've been engaging with AB 617 communities. We've done this through regularly attending community steering committee meetings, which has helped us learn a lot about the community's concerns, as well as some of the exposure mitigation strategies that they're pursuing. We've also been meeting with community organizations within these communities, and this has really helped us to identify possible sites for our study. We also have been we have developed the study protocol, and we've drafted the study materials. We've submitted those to the California Committee for Protection of Human Subjects, which is the state IRB, and have obtained deferred approval pending just some minor revisions, which we did submit a few weeks ago. So we anticipate having full approval soon. So that was a big accomplishment. And now we are currently seeking school district approval to conduct the study in a public elementary school in Stockton. So like all AB 617 communities, Stockton shoulders a disproportionate burden of air pollution exposures, as well as adverse health outcomes. For example, it ranks in the 94th percentile in the state for PM 2.5. It also ranks at or above the 95th percentile for indicators of asthma, cardiovascular disease, and low birth weight. The exposure concerns in Stockton, these are the ones highlighted in Stockton's Community Emissions Reduction Plan, include mobile sources, industrial processes, and port operations. Most of these exposure concerns are pretty similar to those expressed in many of the other AB 617 communities throughout the state. So the main objectives of our biomonitoring study are first, just to learn more about air pollution exposures to children who are living in disproportionately impacted communities, and to evaluate the effectiveness of school air filtration at reducing children's air pollution exposures. So we're planning to conduct our study in a public elementary school located within an AB 617 community. As I previously mentioned, we're currently targeting a school in Stockton, which is in the northern part of the San Joaquin Valley. We As we researched potential sites for our study, we concluded that the best option would be to do it at a school that already has advanced air filtration installed in its HVAC system. And this was really for reasons of both feasibility and timing. Excuse me, MERV 16 filters provide the most effective filtration for fine and ultrafine particles. So we're hoping to do it in a school that has that installed. We are, our target is to recruit from one school 60 children who are between the ages of 7 and 13 and who are in grades 2 through 6. We will be allowing only one child per household. And we also will be enrolling one parent or guardian for each child who will help with the urine collection and also will be completing questionnaires. And all participants will need to speak either English or Spanish. So before going into the specific details, I thought it would be useful just to provide a broad overview of our study design so you can get a feel for the general picture of what we're doing. As I mentioned previously, we are hoping to conduct the study at a school that already has MERV 16 filters installed in its HVAC system. And then as part of the study, we will also be providing additional standalone air filtration units in the classrooms for half the children who are in the study. And these standalone units not only filter for particulate matter, but they also will filter for VOCs. And then we'll be collecting urine from the kids in the study, and then we'll be conducting biomonitoring for metabolites of PAHs and VOCs. And we'll also be measuring levels of biomarkers for oxidative stress and inflammation. We'll also be conducting some complementary air monitoring and sampling. And to help inform and interpret the biomonitoring results, we'll also be collecting additional information in other ways, such as through questionnaires and by doing walkthroughs of the classrooms and the school and the surrounding neighborhood. So for the urine collection, we're planning to collect 4 urine samples from each child in the study. So the urine will be collected on 2 separate days over a 2-week time period. So the first 2 samples will be collected on one day during the first week, and then the second set of urine samples will be collected on another day the following week. So at the start of the study, our 60 children will be drawn from a minimum of 2 classrooms and split into 2 groups. So for the first day of urine collection, all children in both groups will be in classrooms with only the MERV 16 already installed. So during this first week, there actually will be no difference in the 2 groups. And then the first day of the first sample of the day will be collected before school. So immediately, ideally a first morning void. And then the second sample will be collected after school. So after the child has spent the day breathing the filtered air at school. Then after this first week, when we've got all the urine collected and before the second week, we will install standalone air filtration units in the classrooms of half the children in the study. So in this schematic here, we're talking about group 2. Those will be the children with the standalone air filtration units. And then during this week, we will repeat the same urine collection protocol that we did during the first week. So, on one day, we'll collect 1 sample before school and then the other sample after school. And for this week, the before and after biomarkers for group 1 and group 2 will allow us to evaluate the effectiveness of MERV 16 filtration alone compared to MERV 16 combined with the additional standalone filtration. So for the biomarkers of exposure that we'll be measuring will include urinary metabolites for specific air pollutants, including these 4 metabolites of these 4 PAHs, as well as the stable metabolites of these 6 VOCs that are listed here. And the analyses will be done at UCSF under the direction of Peyton Jacob. Then we also will be measuring 8-isoprostane and 8-hydroxy-2-deoxyguanosine, which are both biomarkers of oxidative stress. We also will be measuring biomarkers of inflammation, including CC16 and leukotriene E4. And these analyses will be conducted by Nina Holland's lab at UC Berkeley. So to help inform the biomonitoring results, we will be administering questionnaires to gather information on factors that either influence the air pollution exposures or might impact the biomarkers of oxidative stress and inflammation. Parents will have the opportunity of completing the questionnaire online or on paper. We will ask them to complete the questionnaire on each collection day after they give us their child's urine samples. And this is so that we can capture the relevant time frame of exposure. The topics that we are currently considering for the questionnaires include information on demographics, some household characteristics and recent household activities. We are looking at including information about the child's diet, recent activities, and indicators for certain health conditions and medication use. And, you know, given our small sample size, we won't be able to account for a whole lot of factors in our statistical analysis. So we really want to be very thoughtful about which factors we include on this questionnaire, on the questionnaires, to really make sure we're capturing the factors that are most important for interpreting the biomonitoring results. We also obviously want to keep the questionnaires short just to minimize the burden on our participants. So as is mandated by Biomonitoring California's enabling legislation, the individual biomonitoring results will be returned to parents who ask for them. We did get IRB approval to send the results packets electronically, so that that actually will save us quite a bit of work. So that was good news. The packets will include fact sheets on the measured biomarkers, as well as possible ways to reduce air pollution exposures. We already have a fact sheet for PAHs as a class, but and so now we are starting to develop fact sheets for the VOCs as well as for the biomarkers of oxidative stress and inflammation. An important part of returning results for the biomarkers of oxidative stress and inflammation will be to develop the right language for explaining these as additional indicators of exposure. We're not going to be giving health interpretations for these biomarkers. So to support the interpretation of our biomonitoring results, we also will be conducting complementary air monitoring and sampling. This will include real-time air monitoring for particulate matter and black carbon. We also will be collecting air samples, which will be analyzed for PAHs and VOCs. And the monitoring and sampling will be done both inside and outside the classroom at participating classrooms, some selected indoor common areas, and some other locations outside the school on school grounds. So all of these pollutants have been previously linked at least to some of the biomarkers that we're measuring, and we think these data will be really essential to interpreting our biomonitoring results. Our pending school district approval, we are planning to start recruitment in September. We need to get out in the field by early November so that we can get all of our urine samples to the labs by Thanksgiving. Then the laboratory assays and data analyses will happen over the winter and spring, and so that we can return results to participants next summer, so the summer of 2022, and then we will be presenting the main findings of the study to the community in the fall, so fall 2022. Our most immediate next step is to get school district approval to conduct the study. Once we get that approval, we need to do a site visit and talk to school officials to get more information about the school so we can plan some of the final details of our study protocol. This information, we need to get information about some of the physical characteristics of the school, like what type of HVAC and air filtration systems, the details of that, details of the classroom and of the children's schedule. It would also be useful to get some more information about the meal programs at the school. We also are continuing to develop and refine the study protocol. For instance, we're still trying to nail down the best timing for our afternoon sample collection. We need to identify specific recruitment events or school events for which, that we could use to recruit families into the study. And as I said, we are working to develop and refine the content of the questionnaires. So as we're trying to tie up the final details of our study protocol, there remain a few challenges that we're still grappling with. First is our limited ability to restrict diet. This is probably most problematic for interpreting our PAH results, since dietary sources can be a significant contributor. And while we can't prescribe a specific diet, we are planning to offer guidance on recommended foods. Since many of the kids who attend schools in AB 617 communities do receive food through the subsidized meal program at school, we will obtain school menus in advance so that we can point to specific foods to avoid on the days of urine collection. In terms of our screening criteria for the study, we considered pre-screening for asthma and household smoking, but ultimately ended up not including these factors in our inclusion criteria. This was partly because we were concerned about being able to enroll a sufficient number of participants. We also want the study, this is a community-based study, we really want it to be inclusive, so that any students or families, or all students and families that are interested, have the opportunity to participate. But we do recognize these are important factors, and given that, we thought it's worth raising as this is a topic for possible discussion today. Let's see, as I mentioned earlier, we are in the process of developing and refining questionnaires to make them as parsimonious as possible, but also making sure that we do capture the most important factors that we need to interpret the biomonitoring results. Another issue challenging issue we're facing is figuring out how to best interpret and explain the biomarkers of oxidative stress and inflammation as indicators of exposure. And then finally, we are trying to make some contingency plans for potential issues that might arise, like delays in school approval and the occurrence of wildfires during our sample collection. So we welcome comments and input on these challenges, as well as anything else that I've presented this morning. After hearing from our guest speakers, we will have an opportunity this afternoon to delve further into some of these issues here, as well as other study design and interpretation issues that anyone in the panel or audience or any of our guest speakers would like to raise. Before we go to questions and discussion, I would like to take a moment to acknowledge our study team. This is a multi-institutional collaborative effort, including researchers, from OEHA, from the California Department of Public Health, as well as UC Berkeley, UC Merced, and UCSF. And then finally, I'd like to give a shout out to our community partner, Matt Holmes of Little Manila Rising, who has provided invaluable support to us. Early on, he helped us brainstorm ideas for study sites within Stockton. He's also served as a liaison in our talks with school district staff. So we're very appreciative of his help so far and are really looking forward to continuing to work with Matt as we launch and conduct this study. So with that, I will open it up to questions and discussion. Thank you.
Thank you, Susan. We have just a couple minutes for clarifying questions only from the panel, and then we'll have public comment, and then we'll have the panel discussion. So just any clarifying questions for Susan at this point. Jenny. We're not hearing you, Jenny.
Sorry, I don't have the slides in front of me. I can't seem to bring them up, but can you remind me when you're planning to collect the samples? The timeline slide went by pretty quickly.
Oh yeah, sure. We're
what time of year?
Yeah, early November.
Okay. And was that selected because that was the most polluted month?
Well, it is one of the more polluted months. It was, you know, winter is the best time to do it. We didn't want to do it too early because, you know, ideally it would be good not to do it during wildfire season. And then we couldn't do it too late in the winter because we need to get with our timeline for getting the samples to the lab. We, you know, couldn't push it too far back. So we think November is a good window.
Then I guess my second question, sorry, was you were saying you'd want to avoid wildfires, but it seems like it's such a difficult thing to get this whole study set up that it seems like you might want to ask for additional funding if there were a fire to quickly roll out your protocol and see the effect of the filtration on the fires as well, because that's obviously a huge interest to people. And I was just curious if you thought about trying to augment the study that way, given that the logistics are the hardest part of getting all this stuff ready to roll, or augment your IRB, I guess.
Yeah, well, I don't know that type of modification would require us to modify our IRB. Sarah, I don't know if you want to chime in here. And
chime in for a sec, just to suggest that we leave this for the discussion portion.
Okay.
I think Tom has a clarifying question, and we'll return to this.
Yeah, I have a clarifying question, and I think it should probably roll over to discussion too. But my question is, what was the basis for choosing MERV 16?
Well, actually, that wasn't at the forefront of our criteria for where we do the study. We really, because of our timeline and what's going on in the schools right now, we found a school that we think is a great site, which already has MERV 16 filtration. And that is actually a benefit because it is, you know, the most effective filtration that's out there. But that was sort of a bonus of the school that we were looking at. Yeah.
Well, I'll save this for discussion, but the concern I raise is that the Air Resources Board says MERV 13 or above, and the risk of going higher is that it increases as you go up, you get more filtration, but you get most of the benefits starting at 13. Then when you get to 16, you're putting a higher load on the HVAC system, so you're using more energy. So my concern is that if this study establishes 16 as the benchmark instead of 13, then we're going to have all these schools wanting to go out and buy MERV 16, and then their energy costs are going to go up. and that may not be necessary. I mean, it's kind of subtle. We could discuss this more, but I do think one has to be careful in realizing that if this study uses 16, it'll set a benchmark instead of Air Resources Board, Lawrence Berkeley Lab, say 13 and above.
Yeah, I'll just chime in here real quick, Tom. I know we need to move on to the discussion or public comment, Meg. So ideally, I think CARB did want MERV 16. They actually had to change their regulations to allow MERV 13. So I think we can take that into account in messaging. And this school, that would be part of the evaluation of their HVAC system if it could handle MERV 16. At least that's what we believe occurred. So we're not calling it a benchmark. As Susan said, we have an opportunity for a really important site to study, and they already have this installed.
I need to call for public comment, and let's return to these issues in discussion. Shobha, is there any public comment that we should bring in at this point?
Let's see. I'm not seeing anything new in the chat or questions. We do have a hand that was raised from earlier. Should I go ahead and see if the person can ask the question now?
Yes, let's see what that is.
Great. So Lavon Stone, I see you have your hand up. I'm going to unmute you, and then you'll need to unmute yourself to share your comment or question. Lavon Stone, I've unmuted you. If you have a comment or question, you can unmute yourself and ask it.
Shobha, I'm going to suggest that we recommend that she email her comment, and we can move if there are any questions or comments.
Sure, that sounds good. So Lavon, please email us your comment or send it in via the chat or question feature. I also see that we have a hand up from Matt Holmes. So I'm going to unmute you now, and that should give you permission to unmute yourself and ask your question.
Shobha, maybe you do need to promote them to panelists. Why don't you just go ahead and do that for Matt or Stephanie?
Yes, just did.
Okay.
Matt, can you unmute yourself by clicking the red button?
Oh boy. We're having the same problem that Carl had. Matt, if you wouldn't mind emailing us your comment, you can send it to any one of us or the biomonitoring email, or you can post it in the GoToWebinar. I'm really sorry about these audio issues. I will let you all know. Oh, fantastic. Go for it.
Hallelujah. I'm glad it was my fault and not your fault. I just wanted to say really quickly that I'm super grateful for Susan for really getting out in front of this. We've been talking since I think January, and that's really like a prerequisite for working in a community like ours. It takes a very long time to develop these conversations. And, you know, it was really fortunate that this aligned with our community's priorities to protect schools, particularly this school that's in a cluster of emission sources. And so that's just my little soapbox to all the scientists out there. Be sure to talk to communities early and often. Sometimes y'all do research that isn't relevant to us, but this certainly is. And so I think this is a special study, and we're grateful for the attention. And then the other comment I would make is about the MERV 16 versus MERV 13. I think a lot of those, the horse trading around whether or not we need to have a high enough filter is really based on economics that don't concern me. And I think just simply, spending less at a school because of energy costs is not what I think about when I think about protecting my students. And I'll just also point out that most of these schools have used their ability to borrow to build up significant solar capacity on campus, and so that they're pretty flush with electricity. And so I would hope to set the highest benchmark possible for our most valuable resource, young human brain tissue. So I'm glad that there was already a SEP in place and that the system was already upgraded. And it's absolutely my hope to upgrade as many systems to the highest grade possible as a community advocate. But look forward to learning more from you all. Thanks so much for bringing first-rate science to a part of California that doesn't always enjoy that kind of attention.
Thanks so much for the comment, Matt, and for your involvement. Sorry. I appreciate the comment, Matt, and also your involvement in the program. We have time now until we have 20 minutes for panel discussion of this, and there's some overlap here because we have a discussion on the questions that Susan has put forth, wanting feedback on. We have time for that this afternoon. And so I just want to continue kind of open back up these two issues that were raised by Jenny and by Tom for further discussion.
I'm going to suggest to Susan, why don't you put the challenges slide back up as well right now?
Okay. There we go.
So anything more to say about the MERV 13, MERV 16? I mean, I appreciate, Tom, your comment that there are significant, that the significant gains start at 13, as well as appreciating Matt's comment about like, let's put in place the highest possible protection. So any reflections on that?
No, that's yeah, it's a good point, and especially, I mean, it's really encouraging to hear that the schools are electrified, because that means you're not. Our concern is always that somebody puts in a MERV filter. I mean, I collect a lot of data for my own home, and we ran a 600-watt motor day and night through a MERV filter when the wildfires were there, and it's effective, but it's a cost. But we do have solar energy, so we were making up most of it for that. So that does make a difference. I actually wanted to raise another filtration point, which is on the additional filters, which would be the standalone filters. Now, the one thing about a MERV 13 or 16 is it's not going to get the volatile chemicals. It's really only going to get particle-bound chemicals. But in the market for standalone units, there are several units out there that are available, the higher quality units. For example, Austin Air, and I think, I shouldn't name brands, but there are brands, there's 5 or 6 brands that actually have particle filtration, but they also include activated carbon or permanganate or other layers that will take out chemicals as well as taking out fine particles. So you could remove the MERV filters really won't remove volatiles to any significant extent unless the volatiles are particle bound. But the standalone units, if you buy the right kind, particularly with activated carbon, they're going to be much more effective. So I don't know if this is an issue you're looking into, but it is. And again, it gets into, they do, there's a lot of studies that show those can make a big difference in air quality for chemicals other than particles indoors.
Do I need to raise my hand to?
Go ahead, Susan.
Okay. Yes, we are looking into that. We have identified, when we were putting our budget together, we identified a standalone filtration unit that does target not just particulates, but also VOCs. But we are now, as we're getting ready to actually gear up to do this study, we are continuing to look to make sure that we get the best standalone to address VOCs, because we would like to do that. So if you have any, advice on that, we'd love to hear it.
Well, I mean, just a quick suggestion, I think, and I can help you with this, is the people at Lawrence Berkeley Lab who analyze these filters and their effectiveness. And again, I think, you know, I have a brand, my favorite, but there's probably 4 or 5 that are really well rated in removing a much broader spectrum of pollutants.
Great, Tom, and we can connect with you one-on-one offline. So back to you to keep going on the discussion.
I think Jenny had her hand up.
I had kind of a broader question or comment. One is that I'm thinking about what you really are trying to learn with biomonitoring. Because if you're just looking to see if the air filters are effective, you can do that by measuring air quality and VOCs in the air when they're running or when they're not running. So you could use air monitoring alone to answer the question if the filters are effective. But what you're really asking with biomonitoring is, does that make a difference to their overall day? You know, given everything else, the other 16 hours when they're not at school, et cetera, is this intervention effective in reducing their actual burden day to day? So it seems to me that's what biomonitoring is asking for this study. So, and I'm just thinking of, and I don't know about this school, and many schools don't have this, but a lot of exposure is going to happen on the playground. Not only that it's the time that they spend during recess, but the time that they're breathing much harder running around than they are sitting in the classroom. So that's going to represent a large part of their exposure is going to be outside on the playground. And so I guess one question is, and I don't know the timing of the recess, but and the half-lives of the biomarkers exactly, but you may wish to look at the biomarkers when they have, you know, after they finish running around or sometime where they're not affected by this, or if they have an air-conditioned gym, that they do recess in the gym, because what you might find out that a lot of their exposure does come from outside when you do look at the air concentrations and model their activity. And so, but you don't want to overlook the benefits perhaps of doing recess in clean air. So I just want to bring that up, and I don't know, our schools that I work with do not have air-conditioned gyms that they can use for recess, and elementary schools typically don't have gyms. So it's just something to think about, because there's exposures at school that are not, you know, inside the classroom, I guess. And I have other recommendations for the study, but I guess it sounds like we have another time later. I can also make them later if we have more time. Now I can come back and make those other recommendations, but I'll stop with that right now.
Yeah, why don't you hang on to that for the moment? We may well have time for them now, but we definitely have more time later also. And I'll just see what else there is out there for the moment. Vina.
Thank you. My comment and question is about the kind of additional information to be collected about the school and the building. And, you know, I would just say it's really important to try to document as much information as possible about the building characteristics, like air infiltration rate. Has the school had kind of energy efficiency upgrades or retrofits that might have addressed kind of air sealing and other aspects of the building that could affect air infiltration? And kind of related to that, VOCs indoors can reflect infiltration of VOCs from the outdoors to the indoors, and can also reflect indoor sources. So to the extent there's any information available on potential indoor sources of VOCs, like recent painting or sealing or caulking, like kind of building and improvements, that could affect indoor levels of VOCs, it would be helpful to collect that information as well. And then my other comment was, a comment and question is, if there's any plan for activities that might involve the participants, the children, in kind of engagement with this topic or the science. I noticed Asa Bradman's on the study team, and he has a lot of experience with this, with chamacos. So I wondered if you could comment on that.
Yeah, that's a great question. We are very much hopeful that we can involve the students, you know, in the actively engage them in the study, because we actually don't have permission yet to get into the schools. We haven't started, you know, planning that, but it's certainly on our wish list. And you're right, ACE's got great experience in that, so we're hoping to do that.
Ulrika.
Turn my audio on. Thanks for that really interesting presentation, and it sounds like, I think it's going to be a very exciting study. I had some questions about the PAHs and the diet. You know, you mentioned that you were going to try to look at the menus for the school meals, but I was wondering, I hope that you're also planning in your questionnaire to ask about barbecued or grilled food consumption, you know, during the day before, because that it could be at home as well. So that's an important thing when you're if you're looking at PAHs. And then the other question was, maybe you said this, but the air monitoring and sampling, is it going to be indoor and outdoor, all the sampling? You know, it's for the different things that you're looking at, you know, the purple air, black carbon, VOCs, PAHs.
Yeah, we're gonna do everything indoor and out. And with respect to the PAHs, yes, we definitely will have on our questionnaire questions regarding what they've eaten in the last 24 hours or so. But we're also hoping to try to, as much as we can, advise them to avoid the PAH-laden foods, so that we don't have as much adjustment that we have to do in our analyses.
Yeah. And just to comment, I mean, it's great that you're doing, you know, the PAHs, the biomonitoring that you're doing is really going to give you the metabolites of the lower molecular weight PAHs, and a lot of the higher molecular weight ones that we're concerned about that are mutagenic, et cetera. You can't measure really in urine those metabolites. So yeah. So your monitors, are they going to be able to speciate, you know, look at the different PAHs individually when you're doing the air monitoring?
Yes, they will. I'm wondering, Asa, if you can talk a little bit more. I don't know if you want to comment on that a little further. I don't have all the details of specifically what we're, you know, capturing.
That's okay. I don't think we need to. Okay. We're almost out of time, and we can share the full list. It's of the full list of PAHs that we'll be speciating. We can do that for the VOCs as well.
Great, thanks.
In a few minutes, we're going to transition to a talk by John Balmes, but as I understand it, he had a comment on this topic and presentation. I want to invite you to give that comment now, John, if you can manage to with the various audio hurdles that we have.
Well, can you see and hear me?
Yes.
Amazing. Well, just I'll talk about CC16 in my talk, but the comment relates to Matt Holmes, actually, because he has also been partnering with a group from UC Berkeley and UCSF that I'm part of. We put in for funding to the Attorney General's office for VW settlement money. It's called, you know, vehicular emissions, whatever. And we will be doing it. And we'll be doing, if we funded, and we don't, we're going to be, we'd be working with Little Manila network hunters. And I'm pretty sure it would be, yes?
Oh, your audio and video froze for a minute and it got garbled. Do you mind restating that? You said the last we heard was about the vehicular settlement.
Yeah. Yeah, so if our group from UC Berkeley and UCSF is lucky enough to get funded, we'd be working with Matt Holmes and Little Manila Rising to put in a network of black carbon monitors at homes of children and adults with asthma. And I think it's in the same area that the school is in. Matt could correct me if I'm wrong, but that could be of interest to this study.
Yeah, can I chime in real quick and just affirm that this is the focus area of all of our study work because of the cluster of stationary sources at the port and transportation sources all tangled around it. And then I'll just also add that we had another proposal to the same fund with Dr. Bradman out of Merced to really characterize ambient air quality across the region with particulate matter and weather specificity, because we really want to model where the pollution's coming from. And we have ocean going vessels that visit, several hundred feet upwind from the school. And no doubt diesel boilers are impacting the type of air they're breathing here at the school. And so we should be able to get it if we need to get these awards so we can give you a really clear picture of the air around the school so that Susan's study can help us corroborate that it's penetrating the school. And then I'll just do a final plug. The California Air Resources Board community air grants are out. We're currently formulating a proposal to address the gaps in between these studies. And so I loved the conversation that I heard about understanding programming at the school and time outside versus time inside, and the idea of issuing stay indoor alerts to principals that could be based on preliminary data and not regulatory action just led by a community partner. So if anybody wants to connect with me on that proposal, it will modify significantly depending on whether or not we get either of these Justice Department awards. So really excited to have all these things complement each other.
And this is Stephanie, just confirming that was Matt Holmes who was speaking.
Correct, sorry.
Great, thank you all. We have just 2 minutes or so before we transition over to John Balmes' talk and a chance to circle back to these challenges that Susan has raised later this afternoon. But I just want to invite any final comments from the panelists, or if you want to just mention something to kind of get on the agenda for the afternoon's discussion so that we all have that in the backs of our minds as we move on. Vina.
Thank you. One other thought on some of the kind of building level characteristics that would be helpful to document. I'd say cleaning and disinfection protocols, and if it's possible to document some of the products used. So again, speaking to potential sources of VOCs in the indoor environment.
Great, noted, thank you. Any other, Jenny, was that a hand? Yes.
Only if there's no other people. No. I just wanted to put on the agenda for the afternoon two things. One is additional sampling measures that I might be recommended, and also questionnaire items that would be important, including how the kid gets to school. Do they walk to school? Do they ride a school bus? So some of, just some really important questions, have some recommendations for. And also wanted to say, I'm not sure I would tell people what to eat, because you're trying to see if a recommendation works in the real world, and even though it might help you find a signal, again, what biomonitoring is telling you is how does this reduce exposure as assessed by these biomarkers under real world conditions?
And I'll just quickly chime in to say, Jenny, we have slides with the complete list of questionnaire topics that we'll be showing for the afternoon session. So yeah, definitely. We have a comprehensive list for you guys to review and add to.
Great. Thank you, Susan, and thank you to everybody who weighed in on that conversation. It's an exciting study to be launching, and we'll have more chance to talk about it this afternoon. As we get John's presentation teed up here, I want to introduce him as our first guest speaker. John Balmes is a professor of medicine emeritus at UCSF and a professor of environmental health sciences emeritus in the School of Public Health at UC Berkeley. At UC Berkeley, he's also the director of the Northern California Center for Occupational and Environmental Health. He's also one of the principal investigators of the Children's Health and Air Pollution Study, CHAPS, in Fresno, which is what he'll be talking about today. And John has been studying the effects of occupational and environmental agents on respiratory, cardiovascular, and metabolic health for over 40 years. He'll be discussing results from his recent study on traffic-related air pollution and biomarkers of effect in children in Fresno.
So can you all see my slides? Okay. So, and you can all see and hear me still?
Yes, we can.
I'm in Tahoe, and I think the internet connection is pretty good, but I guess
there might be a slight delay, but we can see you, just so everyone's aware.
Okay. Can I just have some go to webinar assistance in terms of, so right now I have well, I'm just going to go ahead. Anyway, thank you for inviting me to speak on our work in Fresno with regard to traffic-related air pollution and biomarkers of effect in children. Okay, so advancing slides. I'm used to advancing slides in Zoom.
Did you try just clicking on the PowerPoint, perhaps?
Ah, there it is. I didn't click on the PowerPoint. Thank you. Okay, so I don't have any financial conflict of interest, but I am the physician member of the California Air Resources Board. And I did actually have my ears perked up when CARB was discussed about AB 617 and MERV filters. No comment about those right now. So I don't think it's a surprise to anybody, either panelists or the public listening in, that there's an epidemic of obesity in the US. And I didn't actually update this slide, but I think it's roughly accurate that up to 38% of Americans are overweight and 35% are obese. It's really a huge problem. 17% of children ages 2 to 19 are obese. And there's, like many health disparities in our country, there are disparities based on people of color, with Latinx and African Americans having a greater prevalence of obesity in terms of children than other racial ethnic groups. And this is an old slide. It only goes up through 2013, 2014, but it has continued to rise. So it's thought to be primarily due to increased caloric intake from high consumption of sugar-containing drinks and high caloric fast food, but also decreased energy expenditure from a sedentary lifestyle, basically calories in versus calories out. And there's increasing animal evidence that suggests that chemicals in the environment may be obesogens that contribute to risk of obesity. Organochlorines, bisphenol A. This group, expert in biomonitoring, is aware of this. Other environmental exposures that have been associated with obesity, of course, I've already mentioned dietary composition. The gut microbiome is certainly a hot area of research. The built environment, through its role in either inhibiting or enhancing exercise, and then food consumption. You know, how do you live in a food desert where you can't get healthy foods and the only food options are not healthy? And then exposure to ambient air pollutants, which is what the topic of my presentation is today. And there's this particular interest in whether early exposures in utero and early childhood lead to overweight and obesity in childhood, later in childhood, and then in adulthood. So we know a little bit about air pollution obesity. There's actually a fairly robust literature now, and I don't have time to go into details of studies, but studies from the Children's Health Study group in Los Angeles, USC, and at Columbia, New York City have shown associations with traffic-related air pollution and overweight in children. There's also a linkage of diabetes and obesity. Type 2 diabetes, a disorder of glucose metabolism, I think as everybody knows. Basically, the body cells fail to take up glucose from the blood due to insulin resistance. This cartoon shows a normal cell with glucose being brought in to a cell because the insulin receptor is functional. With an insulin resistant cell, glucose can't get into the cell and stays in the peripheral circulation. 80% of those who develop type 2 diabetes are obese. We used to say that was only a condition of adults, but increasingly type 2 diabetes is being identified in obese children. And it's associated with insulin resistance and beta cell, the cells that produce insulin in the pancreas, not functioning properly because they get overused because of the insulin resistance. And then both diabetes and obesity are associated with increased systemic inflammation. And that's one unifying factor with regard to risk in terms of obesity and diabetes that may be related to air pollution. And here's a cartoon showing that adipose tissue, fat tissue, is not just storage tissue. It actually gets actively involved with body metabolism and can actually generate inflammation. And that's this axis of inflammation related to adipose tissue is increasingly being investigated and may play a role in conditions such as diabetes, obesity, cardiovascular disease, et cetera. So we know a little bit about air pollution and diabetes in children. Several studies have shown associations between diabetes in adults and exposure to traffic-related air pollution. And a smaller number of studies, again, the best ones from USC, showing that traffic-related air pollution exposure in children of color was associated with higher fasting glucose and insulin resistance. They were really quite elegant studies. So what's the potential mechanism of air pollution affecting both obesity and diabetes? Well, oxidative stress, which is one of the areas that the proposed AB 617 study that Susan was talking about will be looking at. And oxidative stress can, in the lungs, from inhalation of air pollution, can spill over into the systemic circulation and lead to inflammation. And then local inflammation in the lungs from air pollution exposure can also spill over into the systemic circulation and potentially reach fat tissue and contribute to fat tissue inflammation and insulin resistance. And there's mouse models of diet-induced obesity that show that co-exposure of PM 2.5 with a high-fat diet can lead to really fat mice. This actually is a photo from mice from this study. And based on what I've covered, our hypothesis, and a hypothesis shared by others, is exposure to air pollution in utero in early childhood increases risk of abnormal glucose metabolism and obesity in later childhood. So Fresno, where I've been working with colleagues for over 20 years. Why Fresno? Here's a picture of Fresno on a particularly polluted day. I don't think this was a wildfire exposure day either. And Fresno ranks in the top 3 to 5 cities in the country with regard to both PM 2.5. I'll leave it at that. So our specific study that I'll be talking about today is a component study of the Children's Health and Air Pollution Studies Center that was a joint UC Berkeley, Stanford project until a couple years ago. Our current funding is just through UC Berkeley. But this work was collaborative with Stanford. And, you know, polycyclic aromatic hydrocarbons already been mentioned. That's part of our special sauce. Kathy Hammond and Betsy Noth, my colleagues in environmental sciences at UC Berkeley School of Public Health, have been studying ambient pHs in Fresno for a long time. You know, there are other sources of pHs that have already been brought up today, but we're interested in ambient pH. And this is a map that Betsy made of PAH cumulative exposure in Fresno, with the circles showing, the larger the circle, the greater the exposure. And you can see that ambient pHs somewhat tend to follow the roadways in Fresno. Wildfires, ag burning, and then burning of solid fuel in homes also contribute to ambient pH in Fresno. But over the course of most of the year, it's traffic that's the biggest component. So our research question was, are exposures to ambient air pollutants, especially pHs, associated with increased body mass index, biomarkers of oxidative stress, systemic inflammation, abnormal fat, and glucose metabolism? I'll go into systemic inflammation later. Increased blood pressure. And our study design involved a birth cohort, a child cohort. I'm going to report data from our child cohort from enrollment at ages 7 to 8 today. We're continuing to follow this cohort, or I should say, we're funded to continue to follow both of these cohorts, but we have been limited by the pandemic, actually inhibited by the pandemic from doing more recent follow-up, but we're hoping to start soon. So for all participants, we do anthropometry and biomarker measurements, and we have estimated air pollution exposure to elemental carbon. I think the slides are going to call it black carbon. Betsy and I argue about what we should call it. Nitrogen dioxide, which is a good marker of traffic exposure. Nitrogen oxides in general, not just NO2. And then we have this special PAH 4, 5, 6. So these are polycyclic aromatic hydrocarbons with 4, 5, or 6 rings. And then fine particulate matter and carbon monoxide. Here's a description of our child cohort recruited at ages 7 to 8. You see the mean in months is closer to 8. You can see the weight. We'll be talking about BMI later. Pretty equally split between boys and girls. And what's remarkable we recruited through the Fresno Public Schools, and we had 80% Latinx, 11% Black. So of color, we have 91% of our child participants, and also striking is the annual household income. So 28% of our families had income less than 15,000. So this is a very poor group, and you can see that there's also a fairly high percentage of obesity and overweight. So I'm going to start showing data now. Hopefully these slides aren't too confusing. These are slides or graphs from our published paper in environmental research that came out earlier this year. And we have 4 pollutants below: black carbon, NO2, PAH 456, and PM 2.5. And there's various exposure windows. These are 3 months, 6 months, 1 year average exposures. And then the outcome here is estimated percent change in BMI using a CDC recommended approach. And there was only one statistically significant, borderline statistically significant exposure BMI percentile association, 6-month NO2. But I would like to suggest that most of the point estimates show that there is a potential trend towards an increase. Now I have hemoglobin A1C, percent glycosylated hemoglobin, which is a good marker of glucose regulation. And again, same black carbon, NO2, PAH 456, PM 2.5. And here we have some statistically significant associations with 6-month black carbon, 3-month NO2, and borderline for 6-month, and then with PH 456, 3 and 6 month, and PM 2.5, 3 and 6 month average exposures. Systolic blood pressure, we have, because systolic blood pressure has a shorter exposure response time, we are looking at 1 day and 1 week and 1 month average exposures, as well as the 3, 6, and 3 and 6 month and 1 year exposure averages that I showed in previous slide. And here, again, most of the point estimates are above the line, but we have statistically significant associations for 3 and 6 month and 1 year exposures for NO2. Again, a very good marker of traffic exposure. Diastolic blood pressure, a little less dramatic. I think there is only one statistically significant association with 1 month black carbon, but you can see that, again, most of the point estimates are above the line, showing that trend towards an effect. Urinary A-isoprostane, which is going to be one of the biomarkers that the proposed study in Stockton will use, again, has a short time exposure response, and basically all of the pollutants at shorter time averages especially are associated with increases in urinary A-isoprostane. So that's a marker of lipid peroxidation. It's actually quite a good marker of systemic oxidative stress. Now, the data I've showed you so far have been from our child cohort ages 7 to 8, but we did a follow-up at ages 9 to 10, and I have some unpublished data that I'm showing here for 182 of our child participants. So a sub cohort, we have high density lipoprotein, which is the good lipoprotein in terms of cardiovascular risk. So a decrease in HDL is not good. And so you can see that with NO2 and NOx, we have some statistically significant decreases of the good lipoprotein here. And not much for the other pollutants. And then because you're also going, well, the AB617 Stockton study is considering urinary club cell protein 16. We have, I think, no statistically significant decreases, but again, a trend towards decreases in club cell protein 16 with most of the pollutants. Now, just a little comment in terms of the use of this biomarker. It's not really a marker of systemic inflammation. It's a marker that Nina and I have used in multiple studies, Nina Holland, who's going to be measuring it for the AB617 study team. It's a marker of airway injury, very sensitive to pollutant airway injury, that initially goes up with exposure to an airway toxicant, and then goes down over time. And a lower level of CC16 is actually associated with increased risk for chronic respiratory outcomes, such as chronic obstructive pulmonary disease. So you have to be careful in the interpretation of CC16. It's really not a marker of systemic inflammation. The leukotriene-4 that Nina will be obtaining is a marker of inflammation, but CC16 is, and inflammation is involved in the pathway by which CC16 is released from club cells in the airway epithelium, but I wouldn't call it a marker of systemic inflammation. So in summary, the prevalence of both obesity and pre-diabetes, we didn't diagnose diabetes in any of these kids. The increase in hemoglobin A1C is just a marker of glucose dysregulation. Anyway, both obesity and pre-diabetes are high in Latinx youth in the San Joaquin Valley. Air pollution may increase the risk of both conditions by inducing oxidative stress, airway inflammation, and possibly systemic inflammation, which we didn't actually measure. Childhood exposure to traffic-related air pollution is associated with outcomes consistent with increased risk of metabolic syndrome. You can't properly diagnose metabolic syndrome in children, but the trend towards increased BMI, the increased hemoglobin A1C, the decreased HDL, and the increased blood pressure all are consistent with signs of metabolic syndrome. So we're worried about these kids developing metabolic syndrome as they get older, and we're hoping to continue to be able to follow them over time. And we do have we will be able to follow them over the next few years, thanks to increased funding from the NIEHS. And I can't go through the participation of every member of our study group. I've already mentioned Betsy Noth and Kathy Hammond, but I particularly want to give a shout out to Jennifer Mann, who should be giving this talk, but because she retired, as was mentioned earlier, she stuck me with the job. As Jennifer was really the lead investigator for this project over multiple years. And then I want to end with acknowledging both our collaborators at Sonoma Technology, who helped us with the air pollution exposure assessment, as did colleagues at Cal State Fresno. We did the visits for our child participants at UCSF Fresno, and then our funding for this project was from the US EPA and the NIH. So with that, I think I'm on time.
You are perfectly on time, John. Thank you so much for the presentation. We have 15 minutes now before we break for lunch that is devoted to questions and discussion from both the panelists and any audience members. So I just want to particularly flag in terms of public comment or audience questions. Earlier in the day, these were all broken out, and now it's sort of combined. So if you want to submit a question or a comment, please do that as we proceed with the discussion. And I also just want to flag that while John has been generous to join us today, he can't stay through to the afternoon discussion. So any questions about indicators of systemic inflammation, as we'll be discussing later in the afternoon, relevant to the AB 617 study, if you have any questions about that to John, now is the time to do that. Yes, Jenny.
Hi, thank you for that fascinating presentation and really impressive cohort. I just wanted to know if you wouldn't mind expanding a little bit more about some of the biomarkers like 8-isoprostane in terms of, is there a circadian rhythm to these biomarkers? Because I guess that might come up later with timing of collections within a day. Thank you.
Well, that's a good question, Jenny. I actually don't know about 8-isoprostane and circadian rhythm. I suspect that there probably is. And I can certainly look that up for you and get back to you. Nina Holland, who I think Susan mentioned is going to be doing the 8-isoprostane, she has measured urinary 8-isoprostane in multiple studies that I've been involved with, and maybe other ones as well. So she may have the answer to your question about circadian rhythm. I do think it's a good marker of oxidative stress, and I'm glad that she's now also willing to do 8-hydroxy, I'm going to murder it, 8-OH-DG, because I've been trying to get her to do that for years. I think in part because the AB 617 study team reached out to her. She's willing to do it for me in our Fresno work now too, because for years she wouldn't, because she didn't think it was a particularly good marker. But it particularly, as you probably know, is a marker of DNA oxidative damage, whereas the 8-isoprostane is of lipid peroxidation. So having both of those markers, I think, is a good way to assess oxidative stress.
Then maybe taking a step back, I forgot to ask you to comment also on the half-life, what's known in children in urinary half-life.
Yeah, the half-life, I actually had to look that up for that paper that is in review with the Journal of Exposure Science and Environmental Epidemiology with our 9-year-old data. And now I can't remember exactly, because one of the reviewers asked about the half-life, but it's definitely, it sticks around for long enough to be useful. It's a matter of, it's a good part of the day, the half-life.
Thanks for that. Other questions? Ulrika.
Thank you. That was a really interesting talk, John. I really appreciate your presenting those data. I had a question just to make sure that I understood the graphs. So is it the estimated change from the individual's baseline, or is it relative to a normal value?
It's to the individual's baseline.
Okay, so then one day would be one day into basically 1 day from when the urinary isoprostane was measured. Okay, great, thank you.
And just to finish that, that's 1 day into a high smoke or a high pollution exposure event?
No, it's just that 1 day average exposure. I mean, 1 day prior to when their testing was done. Versus, and then there was 1 week, 1 month, 3 months, 6 months, 1 year average exposure prior to the date of the test.
So you're essentially looking at cumulative exposure based on age.
Well, it's cumulative exposure for the longer averages, but 1 day, 1 week, or not that cumulative. And we did the 1 day and 1 week for the like blood pressure and urinary adisoprostatin that do respond to acute air pollution events. But hemoglobin A1C, has a half-life of several months, so that's why we didn't look at 1 day exposures for hemoglobin A1C. I think Carl had his hand up. Maybe he can actually be heard.
Yes.
Hey.
Let's try it. Did it work?
Yes.
Okay. Can you say a little bit more about the air pollution being in the lungs, causing the inflammation in the airways, and then how the pathway from air pollution in the lung to systemic inflammation? I don't know the field, and I'd be very interested in that.
No, thank you, Carl. I'm happy to do that because I kind of whizzed through that. The air pollutants that we studied, NO2 and other nitrogen oxides, ambient pHs, and then both black carbon and PM 2.5 all can cause airway inflammation. So when they're breathed in at high enough concentration, they will damage airway cells, the cells lining the airway, and then those cells will release signals that cause an inflammatory response. And by inflammatory response, I mean immune cells, both resident in the airway like alveolar macrophages and then potentially cells recruited from the systemic circulation and the bone marrow. This has all been shown actually with PM 2.5 in particular. So you get a local airway inflammatory response to the oxidative stress. I left that out. The oxidative stress that the pollutants cause is what leads to the airway injury. And then there's an inflammatory response to the airway injury. That can just be local in the airways, but if it's severe enough or chronic enough, I think either way, you can have spillover into the systemic inflammation, the systemic circulation, which can actually lead to extrapulmonary effects. This has been shown with regard to blood vessel response. Endothelial function is inhibited by exposure to air pollution. And at least in animal models, inflammation of adipose tissue has been shown to occur with exposure to PM 2.5, for example. So, and actually, ultrafine particles have been shown to be deposited in the brain of animals exposed to traffic-related air pollution. So, there definitely are systemic ramifications to the airway injury from oxidative stress from air pollutants and then the subsequent inflammatory response. I hope that was somewhat clear, Carl.
Yes, thank you. It just adds to the picture that air pollution is really nasty. It does does things to the brain, it does things to the coronary artery system, and now you've pointed out other areas.
And actually, that's why I moved. I'm a pulmonary physician by training, and I started with respiratory health effects, moved to cardiovascular, and now I'm doing metabolic effects in kids. And if I could just throw in something that Tom teed up about wildfire smoke PM 2.5, there's increasing evidence that wildfire smoke PM 2.5 may be more toxic than non-wildfire PM 2.5 with regard to respiratory outcomes. I wouldn't say that that's clear for the other outcomes like cardiovascular outcomes or metabolic outcomes. We don't have those data. But with in terms of respiratory outcomes, there are data, especially with kids with asthma, that suggest that PM 2.5 from wildfire smoke is more toxic. So I think he was kind of teeing up that comment.
I was going to ask that question. You saved me the time or the effort.
Well, you hinted earlier, Tom. And Tom and I have worked together for years, so he knows how I think.
Thank you for that. As I understand, we have a public comment or question. Shobha, I think there might be some connectivity issue. Are we able to do that now?
Yeah, let's give it a shot. Levon Stone, I see you have your hand raised. I'm unmuting you now. So if you unmute yourself, there should be a microphone icon you might see that's red. You can click it and unmute yourself and share your comment.
Hello?
Hi, we can hear you.
Okay, I don't want to take a lot of your time, but I'm the director of the Fort Ord Environmental Justice Network, a community-based organization that has conducted a lot of research in this area because we've been subject to all these prescribed burns, substance called Alumagel, which is a derivative of napalm. And we find out that the state of California, when it comes to the biomonitoring, when it comes to the MAP and OEHI and the air district, they all pass us by. And we have had, our children have been affected by all this toxic smoke along with all the other stuff in the air. And we find it very hard to bring attention to what's going on down here. And I don't understand that because, and just like I heard that, air pollution causes a lot of damage, even to the eye, the retina and all that, because it happened to me during one of the burns on Fort Ord. I just had a corneal eye implant at Stanford, and nobody in my family has any eye problems. And it happened because during a burn, one of the little cinders or something got in my eye. I thought it was just a speck of dust. And we have a big veteran community here. My husband is a veteran. So we are being ignored by the state of California. I have traveled all over the United States and have gotten more attention from those people than I do here. And it seems as though there is a contest between community organizations that do this kind of work and the agencies, because once they find out how much you know and how much research you've done, because we can't even get the grants, we have to do everything ourselves. So I'm just trying to understand why it's continuing. The studies, what are the results of the studies, and how come the studies are only for some schools and not for all of the schools? And we need air monitors. I have a small, tiny air monitor that was given to me by our local air district. And nobody's saying anything about how COVID is connected to all this. And it's not, because COVID is saying we're breathing on each other and we are making each other sick. And it's like it's been a cover up all this whole year of all the other stuff that's been going on in our communities. So I'm sorry to have to make such a long comment, but I was hoping that the participation process had changed to make it more inclusive, and it seems like to me it haven't changed that much at all. So I'll stop right there, and I hope I can get some kind of feedback that would be helpful.
Thank you for your comment, Levon. I think program staff take note of public comment and understanding the community that you're advocating for can help them identify places that are under targeted. I don't know if staff wants to add anything to a response to that.
I hope so.
And if not, Jenny has something to say.
I just had a question for the commenter. I missed where you were located. I'm sorry, at the very beginning.
We're in Monterey, California, where this huge military base closed down, and it's attached to all these communities.
And there's also agricultural burning, you're saying?
Oh, yes, ma'am. Agriculture, you're talking about pesticide up the kazoots and everything else that you all have talked about. We have it, and it's been here a long time.
So Meg, I'll just chime in to say thank you to the public commenter, and we need to move on to our next item, which is lunch. So we have taken note. We will have the full transcript of the comment, and we can be in touch to follow up on this comment further.
I hope so.
Thank you for joining the meeting and contributing. So that's Sarah prompting us that it's time for lunch and we need to break. Excuse me, we have an hour for lunch, and it's requested that everybody return no later than 1:30 so that we can begin the afternoon session on time. And I will just provide the following informal Bagley-Keene reminder that to comply as usual with Bagley-Keene requirements and refrain from discussing panel business during lunch and during the afternoon break, which comes later. So I'm going to not adjourn the meeting, but adjourn for lunch, and we will return here at 1:30. Thank you so much to everybody who has provided presentations and comments and additions to the meeting this morning.
Hey Meg, I just wanted to let panel members know that through your Nerissa's and Stephanie's efforts, we do have a set of recommendations that are going to be shown during the lunch break. So panel members and public, feel free to take a look at these, and we can circle back during the open public comment period on that topic.